It's Dr. Heaton here at Cardiac Muscle Joint Clinic, and today I want to talk about lateral elbow pain or lateral elbow tendinopathy or tennis elbows. A lot of you have probably heard it, and a lot of you have probably had some of this pain. It's just right on the outside of the elbow here, and there's several muscles and structures that can cause this, so I'll kind of get into the anatomy of what can cause it, and then I'll also give you guys 3 exercises, or one's a soft tissue mobilization, and the other 2 are exercises that I like to do with patients and give them at home to do. So I'll walk you guys through that, but stay tuned for that. So another thing to consider with lateral elbow pain is how it typically presents. So you may think, oh, it's just pain on the outside of my elbow, but it can be different versus chronic and versus acute. So things with chronic pain to look out for is potentially that you have central sensitization, which means that your typical presentation of tenderness and pain at that spot isn't necessarily present. And so they have that pain sometimes, but when I go to push on it or I try to reproduce it, I can't really in that moment. And so that could be the thing to consider, is that there could, because it's a chronic issue, there could be, it's called central sensitization. They've had it for so long that your body kind of changes its pain pressure thresholds throughout. And then another thing is just how it presents typically. So you most often I'll see it as an acute condition. Someone just like, they were doing, I actually saw someone doing it with double unders, saw someone doing it with, clean and jerks and squatting, and they came in just like, yeah, my lateral elbow is killing me and the outside of my elbow is killing me. So there, I could push on it, I can do all stuff, and it reproduces that kind of achy pain. And a lot of times they lose grip, or they have grip weakness or painful grip. And so that's typically how it'll present. So that's what I'll usually look out for. But if they hit to kind of describe that lateral elbow pain, but I can't really find out, like, oh, I can't reproduce it or stuff like that, then I may think that it's more chronic, but I'll still kind of attack that area and maybe even look at the wrist and the shoulder to make sure that I'm looking at the joints above and below that area. So hopefully that's helpful, and then stay tuned for the exercise.
Run through kind of the 3 exercises that I'll typically give patients. The first one I may not give patients as much, but it's something that you guys can do on your own to help maybe kind of release those muscles. It helps just kind of desensitize the area, make the muscles feel a little looser. So first one, it's called just a pin and stretch. I'm sure you guys have heard of that. You'll extend the wrist so that those muscles are, contracted, and you'll kind of take your thumb and pin them down, and then you will flex the wrist like that. So extend, maybe even bend the elbow a little bit. Extend, bend the elbow, extend the elbow, and flex the wrist, just like that. So you're trying to kind of contact those extensor muscles. So like there's a tender spot right there, and you just kind of work your thumb around, find those tender spots there, extend the elbow, and then flex the wrist like that. And you'll feel a pretty good stretch in there as you do that. And you just kind of find tender spots with your thumb and just work those over. All right, guys, so this next one, you can take a dumbbell, and this is more targeting these muscles here. So what you're going to do is you can combine concentric and eccentric contractions for this. One's not better than the other. Actually, combination tends to be the best. So what you're going to do is let's just start with the set of 10 of just regular contractions. So you're just going to go here, lift it up like that. Good. And obviously, if the weight's too heavy and it starts to cause some pain, then back it off and just do like a lighter weight. There, just like that. Then, what you'll do, you'll switch sides, and then you can do like more of an eccentric focused one. So you'll bring it up like this, and then you'll slowly, like a 3 to 4 second count, bring it down, then bring it back up. 3 to 4 second eccentric, bring it back down. And then the next one, pretty simple. What you're going to do is it'll actually help work that supinator muscle that I talked about in the previous video. And what you're going to do is just be here, and you're just going to rotate back and forth like that. Trying to minimize how much your elbow is actually moving, and just trying to focus on working those forearm muscles. Because people have a tendency to roll their shoulder in like this. What we want to do is try to keep that elbow on the bench, try to keep that shoulder in the same spot, and just roll over as far as we can. And come back to neutral, and go back, just like that. All right, guys, give those a try. If you think those are helpful, leave a comment down below. And if you have any questions or comments, let me know.